right, thank you.
All
All right,
taken care of.
so here we go. So welcome back, everybody, to the monthly Friday webinars with Dr. Christina Chambreau, myself, Jeff Feinman. We're from Holistic Actions, where we exist really to support you all, support all pet parents, pet professionals along the path to optimal healing of the mind, body, and spirit of your animals. And our intent is to put the S back in holistic, and the S stands for spirituality. And Dr. Christina, do you want to mention a few things about housekeeping, like how to react or raise your hand?
So if you all, so there are two ways to ask questions. One way is to post it in the chat. Now, as you know, the chat may get really busy, and so we may not get quickly to all of the chat, and you may get lost. So if we haven't heard from you, post again. Another way is to raise your hand. And the way you do that is to find the button labeled reactions, which is a smiley face with a plus. And there it says raise hand. So when you raise your hand, like Ruth did, and like I did, that little hand comes up. And then once we finish talking, or as we're talking, lower your hand. So then I don't forget that I talked to you and keep calling on you again. My memory is often very much in the moment. So Cindy, welcome for being here for the first time. Another housekeeping item that I would love, and I may repeat it, is if you would, when you're raising your hand, or even in the chat, just say if you're an HA member, because that will, I can answer it a little differently if you're an HA member. So it'd be great to say that. I mean, I know some of you, but not everybody, and that'll just remind me. And again, for those that just joined, the chat will be emailed to you. If you want to save it, there's 3 dots down there or some way that you can save it, depending on what kind of a thing you have. So let's get going. And we have Ruth to start. Go ahead, Ruth.
Thank you. And I am an HA member. So 2 dogs this year, I decided I'm not doing the topicals or the flea and tick. I'm doing the tag instead. And unfortunately, when I had their fecals tested, they both came positive for hookworms. So I know that's out in my environment, that they're very difficult. I'm having to use the Drontal Plus right now, but I'd like to know what I can use once this treatment is finished to help keep them from picking up the worms again. They're always out there eating wild animal droppings.
Well, most wild animal droppings are they eating mostly vegetarian wild animal droppings, like rabbits and deer? That's totally healthy.
Squirrel and fox, more likely.
Okay.
Fox.
Okay. So a key, and I know you know this, but if they're getting parasites, then their vital force is out of balance. And so you want to be doing everything you can to rebalance the vital force. And particularly, you want to be focused on the digestive tract. So I would be maybe doing more probiotics. You might even want to look at doing a fecal transplant. If they're eating a lot of stool, really craving it, I would be looking more at the gut, some prebiotics. And remember, you want to try to rotate and not do just one. And which tag are you using for the fleas and ticks?
It's the only natural pet one.
Okay, so that is an EMF one, a micro charge one. And does it seem to be working for you?
Well, so far I've not seen anything, but I've also decided I've done a little bit of other reading, a little bit of rose geranium topically.
Okay.
One at the neck and one at the tail. So I'm going to try to keep up with that and hopefully not have to do anything else.
Great. The other tag for everybody, there's several brands of tags that are basically a frequency. And then there's a tag called tickless that's an ultrasonic. And that there are two different mechanisms of action. And the ultrasonic one, you don't have to worry about them getting wet. It doesn't seem to take a long time. You don't have a lag time to get it started, and you can take it off, you can put it back on. So it's just some work better than others is the bottom line. So rose geranium is often good for preventing ticks and fleas. If they're healthy, they just shouldn't get fleas. And there was one, oh, in terms of the worms, you may want to concurrently with the Drontal or with whatever you're using, you may want to be using Para-Auta site, which comes from Jackson Galaxy Solutions that our Dr. Jean Hovey put together. I recommend that if animals get tapeworms, I recommend they do that.
Thank you. I have a lot of his solutions. That's the one I don't have. So I will.
Now, make sure that you also, if you're putting an order in, make sure that you also put in
spray
the vaccine detox.
I have that one.
Good. Okay. Just want to have that on hand.
Thank you.
Okie doke. Jill's next. Go ahead.
Hi, I'm not currently a Holistic Actions member,
Okay.
but I have been in the past.
Good.
I'm fostering a dog right now who's got some skin sores. He was on antibiotics for 8 weeks, and that didn't clear it up. And now they've gone back and done more testing to determine if it's bacteria, fungal, or autoimmune. And you know, I'm kind of in a difficult position because it's through that I'm fostering him through a rescue. The rescue's paying for the medical care, and the decisions are going through them. But I know, you know, this could be more effectively addressed in a holistic way, starting with diet and seeing what he's allergic to food-wise. But I'm just not sure where to start, and just wondering if you have any recommendations.
Well, you are in a challenging position because it's a foster. If it wasn't a foster, I would really encourage you not to worry about the skin, because if the energy field is off balance, but healthy enough to produce symptoms on the skin in order to rebalance itself and get back in homeostasis, that's a really good thing. And you don't want to suppress skin symptoms, because then it may cause more severe, deep-seated problems in the future. I don't know what control you have. Definitely diet will help.
Mm-hmm.
And you're not going to be working with a homeopath or a Chinese medicine vet, I guess, because you're fostering, and they wouldn't pay for that. So I wouldn't worry about allergy testing. It's not an allergen that causes the skin problem. It's an allergen pushing the energy field off balance. And when it does that, then the vital force energy field produces symptoms. If you may want to, given that you're this far down with 8 weeks and all of that, you may want to re-up your membership for at least a month or two and go to member resources library and then click on skin. And we have an entire document that talks about soothing things you can do for the skin. And there are multiple things that you can do. So that would be my best recommendation right now. And not worry about more testing at this point.
Okay, but as far as diet, is there anything that
raw food, like omegas, probiotics, prebiotics, all of that. And that you can do, everybody who's not a member, if you go to the Holistic Health 101 class, we talk about nutrition there. And so basic good nutrition of a fresh food diet can sometimes just completely turn skin stuff around, amazingly so. And then the other is, if you know any, given that you foster, do you know any energetic treatment like Reiki, scalar, web, any of those?
Reiki.
Okay, are you doing Reiki on the dog?
Yes, I have.
Regularly?
No, not consistently, because I didn't think about it in connection with this.
Great. Reiki is for everything. Absolutely
Okay.
everything. It helps rebalance the underlying energy field imbalance. So that's a really key.
Okay.
Okay, great. Thanks, Jill.
All right. Thank you.
Shannon, you're next.
Hello.
Hi.
So I'm not a member yet, but I am definitely going to become one. I have been dealing with my mom's surgeries and a cancer diagnosis of her, so I've been a little off
Wow.
track,
I bet.
which puts me here with my dog, who I usually just scale around all the time, and I've been off track with that too. He had a mast cell tumor that was removed, and he's been on all sorts of nutritional stuff. He does half cooked, half raw. He's doing better on all lightly cooked right now because of his age.
And that's fine. That's
Yeah.
fine. It doesn't matter. Fresh food is what's key, whether it's
Yeah.
raw or cooked.
100% fresh food and has been for a while because I'm
Mhm.
in this field. And he was having a lot of itching, which was environmental because it came when all of our pollen came. And I've gotten a lot of the itching under control. And now he has eye goobies in his right eye only all the time. Like I take it out, it comes back. So I am just a little perplexed as to what I might be able to do for that.
Well, interestingly enough, I mentioned earlier early warning signs. So there is a list of early warning signs of imbalance. And many of these are listed in the free course, the 101 Holistic Health for Animals course. And one of the ones is eye discharges.
Okay.
And and all these are is clues. So don't worry. Here's the key for everybody. When there's a symptom, symptoms are clues to what's going on internally. So don't focus on, oh my God, there's an eye discharge. I've got to get rid of the eye discharge. Rather, there's an eye discharge. That means there's an underlying energetic imbalance. Maybe I need to do scalar to be helping myself and my mom and the dog all at one time. You can do it for multiple at one time.
Right. Yep.
And it may help you with all the stuff you're going through.
Oh, I do it on me every day, and then I try to send it out to my whole farm.
Perfect. Okay. So keep doing that every day. That means you have been treating him every day with scalar.
Okay, good.
And so you might want to talk to a scalar person who trained you and see if there's a tweaking you can do to make it more powerful.
Oh,
But
I know. It's Joan Ranquet, and I can take him into my laboratory. Yeah.
Oh, perfect. And you can add him to the Joan Ranquet group. So for everybody, Joan Ranquet and Dr. Feinman, I'll maybe type that in, teaches a wonderful animal intuition and energy healing courses, multiple ones, and has written books. She spoke to us about a month ago. And she also has a long 18-month course where part of it, they work in shelters and horse rescues, et cetera. And since you have a horse there, Shannon, sometime this year, I'll come out with the Healthy Horse Journal. And for everybody, if you don't have the Healthy Dog or the Healthy Cat Journal and you're a member of Holistic Actions, it's one of the free benefits that you have. You download it and assemble it in a 3-ring binder. Otherwise, come to my website, ChristinaChambreau.com, and you can order one there. And that way you're tracking symptoms. So I think you're moving in the right direction. You may want to tweak the diet a little bit and just see, but having discharge could be a good thing if everything else is going well.
Yeah, everything else. So I was wondering if it was just him kind of getting rid of something
It
out.
absolutely could be.
Okay.
Yep. So just keep track of how things are going.
Thank you.
You're welcome. Okay, Verena, you're up.
Hello, everybody. I am a member, and I have a question actually regarding my dog, which is 15 months old. He just had the annual checkup, and basically everything is fine. He was tested positive for Lyme disease. And then we did what is it? The C6 test, and that came back actually at 36. So obviously he was exposed, but the dog doesn't show any signs of Lyme disease. He is so energetic. He eats. There's absolutely no sign.
So all it says is, here's a dog who has been exposed and his body has reacted in an appropriate way. And if you retested in a month or 2 or 3 months, it would probably be clear. But as long as there are no symptoms, don't call it Lyme disease, just call it Lyme exposure.
Okay. So do you think I should, what I've been doing actually, I put him on Ledum?
Nope.
No.
So here's the thing, for everybody who's using homeopathy, there's 2 approaches to homeopathy. The best approach to homeopathy is individualized treatment, where we list all of the symptoms a person or animal has. We go to the books and we figure out what the match is to this ill pattern. And when we give the right remedy, we are restored to balance and all the symptoms go away completely. That's proper, that's using homeopathy in the best way. Now, other people, or some people, and there are times to do this, will give a remedy for a problem, not individualized. Every dog that got a tick bite, give them a dose of Ledum. Every dog with a positive Lyme disease, give a dose of Ledum. Every dog that's injured, give arnica. Every dog that had a vaccine, give Thuya. Like that. That's not really homeopathy. Now, sometimes it's effective. Arnica after a trauma, 80% of the time will probably help. Apis after a bee sting when it's swollen and reddish looking will probably help. But we want to stay away from too much of that. So if you want to do Ledum after, if there are some symptoms that match, then you could do it. Giving 1 or 2 doses isn't going to hurt, but it's probably not going to do anything. Dr. Jeff, anything more on Lyme disease? He's our expert on Lyme disease. By the way, there is a whole course, Verena, on the HA website on Lyme disease. So you might want to read that.
Okay, thank you.
Dr. Jeff?
Yeah, and I was going to recommend the course as well. And also, Verena, I put a link in the chat for a combination of herbs that are directed especially for Lyme and other tick-borne diseases. And that would be a good thing to use, whenever you're concerned. I will say that a 30 is really, really what I would call borderline low. I mean, if it's 100 or above, I might consider that there was enough exposure to affect the dog, but yeah. I've never seen Ledum actually work for real acute Lyme disease.
Okay.
And that's the difference of different people. So Dr. Steve Tobin in Connecticut, for him, and he did lectures at conferences, 100% of the time, Ledum helped with both acute and chronic Lyme. But he wouldn't have even recommended doing it on a regular basis or when there are no symptoms. So different practitioners have different philosophies and different effects. And that's why you'll find for everybody who's at Holistic Actions or thinking of joining, you're going to get different information. And you have to run it by yourself. And that way you can try one person's and then another person's if one way doesn't work. Does that answer your question? It sounds like you're right on the right track. And if you haven't done the 101 course, Verena, make sure you do that.
Okay, I will do that, yes.
Yeah, that's
Whitney,
important.
Whitney just posted in the chat that that her pup Siren had a C6 526, and I don't think she was sick,
Yeah,
but
no symptoms.
regardless, but just with the herbs, it went down to 187, which is a huge decrease. And again, I think that Verena, with just good balance, springtime, getting them outside, giving lots of love, you're going to be negative, in no time.
And then, of course, learn an energetic modality like Reiki, Scalar, Web. There's so many that we've talked about at HA. And do that on a regular basis, the best preventative you can do.
Okay.
I have a quick answer for Deb in the chat. Any animal with arthritis or any animal that has like a little bit of hip dysplasia or a breed that tends towards having joint problems, definitely you want to do stretching and fitness exercises at home, 100%. We've had several lectures on that. So remember, you go to webinars, and it's not perfect. Some of our titles may not have exactly what's in them, but you can go to arthritis on the resource library if you're a member of Holistic Actions. If you're not a member, you can go to the forum and read what we've said about arthritis and stiffness. And then you can go to the list of webinars and run through the whole list. And any one that pops up that says stretching exercises, preventing problems, that will guide you, give you more guidance. And Dr. Lori McCauley has YouTubes out the wazoo on it. And Tellington T-Touch is really good as well for joint kind of problems. Okay, Nikia.
Nikea.
Nikea.
Hi.
Hi.
I'm new to this, so I'm not a member yet. My 3-year-old cat has struggled with vomiting while eating and hot spots her entire life. We've tried feeding her Steve's Raw of various proteins, but any tiny bit makes her vomit while she's eating. She's currently eating Tiki Cat canned, and she's been on a rotation of Adored Beast probiotics, and then I also added Slippery Elm into that. I introduced digestive enzymes a few weeks ago, which she seemed to be okay with, but now all of a sudden, if I put it on, she vomits, but after she eats for some reason. If I take it off, then she's fine. Excuse me, I've done research on the Adored Beast leaky gut protocol. I don't know if you can, like, is there anything else? I'm not sure. I've done so much research on this that I'm not sure where to go at this point.
So the key is we talk about at Holistic Actions, HMDM, Holistic Medical Decision Making. And step one is to set your goal, which might be an emergency, go to the vet, might be go to the vet and get more diagnosis. But usually it's rebalance the energy field so all the symptoms go away, skin and digestive. And by the way, the digestive system is skin. It comes from the same embryological thing. So it's not surprising when you have both going on at one time. And then 2 is to do research. And the most important one is the symptoms. And you're doing a great job. When you become a member, download the cat journal and you'll be able to track things more easily. But you're doing a great job of noticing, if I do this, then this happens. If I do this, that happens. And you're also seeing what we talk about response to treatments, which is you're getting palliation, the temporary help, and then the problem comes back. And that's what's happened with the diatomaceous earth. So in your research, number 1 is the symptoms of your animal, mostly focusing on overall. How's your cat doing? It's been going on for years. Is your cat happy, running around, healthy, or is the overall quality of life deteriorating?
No, she's really good outside of the fact that, like, she can't keep food down sometimes. I mean, since we've switched her over to Tiki Cat canned, she's done a lot better.
Right.
It's way less rare, or it's way less frequent for her to be vomiting, but it's still coming up as a thing. And I don't want her on that forever if I can't, if I can do better.
Yep, absolutely. So because of it's been going on, so number 1, you don't feel pressured at this point. You could begin to work now with a homeopathic veterinarian or a TCVM veterinarian. And back to Deb, a chiropractor would be great. Anybody who has arthritis as well. So you might want to be working with a veterinarian to help guide you. And again, there's no one right expert, no one right answer. So you're doing fine to try different things. In terms of food, you've done the Adored Beast. It'd be fine to do their other protocol and try it and see if that works. And in terms of the food itself, you could experiment with fresh food that you have pureed, maybe cooked, lightly cooked, and then you puree it and try like fermented goat's milk, fermented fish broth, just fresh local raw goat's milk, cottage cheese, pudding. Experiment with some different fresh foods just to see if they all do the same thing. Is it consistency or is it what's in the cat, that kind of thing?
I have to listen.
So I would.
Do you have any protein recommendations for
all
that?
Of the above. That was dairy, egg. You can do raw egg. You can do scrambled egg. You can do, you can try frozen ice, really healthy frozen yogurt. They make ice cream for pets. I bought that for my daughter's dog when he had cancer, and that was what he was eating because he wanted to eat her ice cream. So then after that, we got the better ice cream. So it's really exploring. I wouldn't do that necessarily with your cat now. That's if they're pretty ill. But keep exploring.
Okay.
All of the above is the
Okay,
bottom.
thank you so
Rice and
much.
fish. You're right. And looking forward to seeing you on Holistic Actions, Nikia.
Thank you.
You're welcome. Oh, here we go again. Reka. Miss Upal. You're muted, hon. Can't hear you. There you go.
Hey, thank you, Dr. Jeff and Christina. Respected, a lot of respects to you both. And I am a Holistic Action member for a long time now.
Good.
I am regular on your maybe Zoom meetings, but I do go on the website and try to read as much as I can with the, with the life I lead, and I have Sprinkles. He's Prabir. He's 15-year-old Morky. He's been having trouble with now officially diagnosed, I had no idea, as Cushing disease, and also IVDD, So my predicament is he's been on homeopathy medicine since 6/29/22.
And when who were you working with?
Ramelmeyer, So she's been telling me, diagnosed it like that. She just told me about his liver enzymes, right?
Yeah.
So we got this out. So he was on a homeopathy medication she was giving him. He was on standard process supplements, animal essential, and home cooked non-inflammatory diet. I was cooking every day with turmeric, ginger and flax seeds and pasture eggs. He gets Reiki 4 times a week, and he also gets there's this lady I know in Canada. She does some healing work, and she's been working on his spiritual body as a physical body. So all of that is I'm doing, and I'm not getting anywhere because his blood test was done recently, and Dr. Deb told me that if he doesn't get on the medication for Cushing's, he's going to have difficult being stable and comfortable. And I noticed that he was going down really fast. So I mean, I put it, then she recommended trilostane. So she's starting him in a lower dosage. And she says we would like to test his blood every month to see what his, what the accurate dosage will be. But my also problem is the side effects that comes with that medication. It'll create other problems for him. But in the time, what I did is I also, since I'm from India and I grew up in homeopathy medications, I found out in Kolkata, there is a very famous group of homeopathic doctors, Dr. Banerjee Protocol. Yes, you probably heard of them. So I reached out to them, and I talked to one of the doctors, and she said, we will sit down. All the doctors will sit on a board meeting and send me his records, everything I send, pictures, videos. They want to see what he's like. I wrote down pages and pages after him, and I sent it to them. So they just recommended like 9 different medicine that I'm buying here. I'm having difficulty locating all of it here. But I have asked my brother-in-law from India. He's coming from here, US, from India on the 7th of May. I've asked him to bring like big bottles if he can carry from the pharmacy there.
Good, so excellent.
Yeah, so he's on homeopathy since I would say last 4 or 5 days now.
So is he better?
He has days like today. He has really lack of energy, and I don't know if it is because of trilostane. That's also a side effect, right? Lack of energy.
Yeah. So any drug. Yeah. So I want to interrupt you a bit because we can't spend 20 minutes on one animal. So I want to first let everybody know, I want you to be noticing what she's been doing. She has tried different things. She's tried different approaches. She's thought, that one's not working. What about this? She's evaluating what's the effect on overall quality of life or being, behavior, energy, appetite, and mood. And she's paying close attention to that. The one thing, I'm not sure what it is that they're recommending that you can't get, if they're Ayurvedic medicines, be a little careful as you're adding in things. Cats, I'm sorry, this is a dog, but even small dogs sometimes can get overwhelmed very easily. And because of that, you want to carefully add in things because you don't want to throw off their appetite. And Dr. Jeff, would you like to comment on trilostane in Cushing's and what she's doing, if she should continue trilostane or maybe try the work more with the Banerjee protocol?
Yeah, I know. It sounds like what Rika is doing is a great balance, and it's so early with what you're doing. Just keep doing what you're doing and maybe make that post to the forum that I know Kim is helping you to get on the forum so we can keep this conversation going every
Excellent.
day. And so, yeah,
Good.
and thank you, Rika, for coming. I know it's been difficult for you
Yeah.
to get on.
It's
Yes,
also, get him a little bit, yeah. And he has IVDD, so he's also going to go acupuncture next week for that.
Okay.
So that,
Great.
Now be sure you check with the Banerjee people and make sure they know you're doing the acupuncture, because that may tweak how they want to do things. And see if the acupuncture veterinarian can do pulse and tongue diagnosis. And then in terms of getting, if there are any Ayurvedic ones, Ayush Herbs is in the US, and it's for people as well as for, it's for animals as well as for people. So Ayush Herbs is Ayurvedic.
so that could be given to him?
Yes. Yep. And he actually does consults. He actually does phone consults as well with Ayurvedic. But again, be careful not to overload things. You know, pay attention carefully. Don't throw everything at one time, except energy work. You can't go wrong on energy work. You're Reiki and the healer. But you don't want to do too much at one time. Just be careful on that.
Okay.
And remember, your happiness, joy, dancing, your positive thinking, this is for everybody. If you're doing a great job, I can hear it in your voice, but I want to remind everybody not to worry. Oh my God, we've gotten worse. We've got Cushing's disease now. Okay. Oh, now we're going downhill. You're not doing that, but a lot of people would. And the more positive you can be, the better. I recommend listening to Bernie Siegel's talk. And remember, you can listen to these while you're driving or house cleaning or cooking for your animals. I wouldn't do it while you're cooking for your animals because you want to put love into the food. But we have a lot of the spiritual aspects. So the more we can imbue spirituality and love for our animals, the better. Okay, thank you.
Thank you so much.
Patty, go ahead.
Hi, thank you. I'm not a member, but my good friend who you already talked with this afternoon, Ruth Corey, is a member, and she connected me with you.
Okay.
I have a cat who is probably 17. She was a foundling. And for the last 3 months, she's had diarrhea. My vet has tried everything. My friend Ruth has suggested things that she's learned from here. Gut Restore from Kitty Biome, Gastro Elm Plus, and they've helped for a little while, but nothing is last. My vet says that that Gypsy has either IBF or lymphoma. The sonograms show a thickening of the intestine, but no growth. And
so it could be either of those. And from a holistic standpoint, it's not really critical. How's she these last 3 months? How's she feeling? Is she active and playful and eating?
She feels fine. She acts as if everything is okay.
Good. Okay.
She's playing. She's never been a big eater. She's a teeny tiny cat, barely 5 pounds.
Okay.
She's never been big, but she's still playing. She snuggles.
Perfect. That's really an important key. When something like this happens, particularly with an older cat, if this were a 2 or 3 year old, I'd say keep trying suggestions, or join Holistic Actions and post on the forum for more specific suggestions that we can give for this specific cat. However, because she's 17, I would definitely begin now to work with a homeopathic veterinarian or a good Chinese medicine veterinarian. And the way to find one is type in, and it's free, type in holisticactions.com/select and read the entire article, do the steps, and be patient, which the article will tell you.
Okay.
Okay.
Yeah, I do know
luck.
a holistic vet who I just remember that she does do Chinese medicine, so I'll check with her.
Well, first read the article,
I'll look
okay?
at, yeah,
Because
so it's
it's going to
holistic action.
educate
Okay.
holisticactions.com/select.
Thank you so much.
It will help you evaluate the vet who does some Chinese medicine to find out, is she really looking at the whole cat, or is she just using some Chinese medicine?
Okay.
Is she going to just give you an herb for diarrhea, or is she asking you a whole bunch of questions? See the difference?
Perfect. Absolutely. Very, very big difference. Yes.
Great. Take care.
Great. Thank you so much,
Good
Dr.
luck.
Christina. Appreciate it.
You're welcome. Rachel? And you'll need to unmute yourself. That was the video. Now you need to do the muting, the microphone button.
Hi there. Yes, thank you.
There we go.
I'm actually asking for a friend. She is a vet tech at our local inner city shelter, and somebody dumped just a few weeks old, not even old enough to be away from the mama, a dog with cerebral hyperplasia.
Yep, hypoplasia probably.
Hypoplasia. Okay, yes. Okay, and I'm asking pretty much for her.
So
I
what
just met
she
this-
needs, so what she needs to do,
Yes.
many cats with hypoplasia and dogs,
It's a dog.
I know, but many cats
Oh.
and dogs with hypoplasia live long, healthy lives, and some short, healthy lives. They actually do quite well, stumbling and falling and tripping and all the stuff that they do. But it's really important when you have a condition like that to be working with a holistic veterinarian. So you definitely want to go to the article holisticactions.com/select and
Okay.
see who's near and read the entire article.
I
and
have
then-
one that I use. He's about 45 minutes away. I'm just trying to, she is getting her on a good fresh food diet.
Yes, absolutely.
I'm the kooky holistic friend that I've been
Yep.
going through this many years.
Have
And
her read the take the 101 course, which is for free.
okay.
And
Okay.
that will help give her the perspective of symptoms, and it'd be very useful in the shelter. And the other thing, energy medicine can help profoundly. And with Reiki, there is a group called SARA, which stands for Shelter Animal Reiki Association. And they encourage people trained in Reiki, I didn't type that quite right, trained in Reiki to go into shelters, and it helps animals be healthier physically and emotionally. So encourage her to learn Reiki, both for this kitty, but also for the whole shelter.
So I did take the Dr. Edwards first course.
Oh, the web. Yep.
Yes, and I took a course with Dr. Marlene Siegel and the Black Therapy with fascia release.
Yep.
I don't know, I didn't ask her, but we're in New York State, and the licensing is very you can't really touch anything unless you're at least a vet tech.
You can touch it if you're not charging.
There you go. Okay. There you go.
And certainly
But
if you're working in a shelter, you can do pretty much anything.
Okay, I'll let her know that. But I did just recently meet this dog, and she melted my heart, but she's gonna be big because she's 5 months old and she's about 45 pounds.
Yep.
A love, an angel with her children. She's got 2 kids under 5.
We need to move on. I got it. Do you have another question?
She does have diarrhea, and
okay, so
mushy poop.
You want to work on all of the gut stuff. So are you a member of Holistic Actions?
I am, and I know it all because I've been through it all. So I've already passed it on to her.
Okay, great.
All right, thank you. Bye-bye.
Bye. Naseem, you're next.
Hi, Dr. Christina and Dr. Jeff. I have a question about a tiny little 3.5-pound Chihuahua girl, about 10 years old, that we have in our rescue. She is on cooked food, sometimes raw as well. No vaccines or anything toxic goes into her body. For the longest time, she's been having tear stains on her face that come and go. It's not always there. She goes through periods of no stains at all, and then now for the last 2 weeks she's been going through major tear stains. And then as of yesterday, now we've noticed that she's holding her head tilted to the left and trying to scratch the ear and shaking the head, like something going on with the ear. I took her to the vet. They looked inside. The only thing that I could see was a bit of wax in that ear and a little scratch, which is probably she's scratched herself. Other than that, she's doing very well, eating, playing. It's just a head tilt and the shake that she does every now and then. They did a swab. There's not a lot of bacteria there to qualify as an ear infection, but they did detect some bacteria in that chunk of wax that they swapped. So I don't know where to go from here. They suggested a round of antibiotics just in case, but I don't like doing just in case kind of antibiotics. So where do we go from here with this girl? She also has no teeth, so it's not a tooth infection that I'd say might be causing the tear stains. So we're at a loss as what to do with her as far as the tear stains goes, because I know that's a symptom of something that's going on with her.
So first off, it's not necessarily a symptom of something. Don't start thinking disease.
Okay.
Even ear problems are not caused because there's a bacteria came into the ear. There's always bacteria in the ear. There's always yeast in the ear.
Yeah.
The ear problem is caused because the energy field is out of balance. Now, we don't know what causes the energy field to be off balance. So everything we talk about in the 101 Holistic Health for Animals course about feeding a good diet, and you have to experiment. Different animals need different diets to maximize having good gut health with probiotics, sometimes digestive enzymes, maybe fecal transplant. These all can help. And energy healing, like we've been talking about. And as I mentioned earlier, if the energy field is strong enough in the body to make skin symptoms, eye stains, ear problems, itchy skin, that's a good thing, because that's a clue. It's pretty well balanced, but something's bothering it. And you may never figure out what's bothering it, but if you can soothe or even do energy treatments to get it rebalanced, that's the key. In terms of eye stains are an indication that the energy field is off balance. However, it's one of those symptoms that often is one of the last ones to go away once they are 100% cured. So you want to keep doing different healing approaches until a stain is gone, but don't worry too much about it.
Okay, now, and as far as the ear goes, I guess that will also go away once everything is balanced.
Exactly. And in addition, are you a Holistic Action member?
I am, yes, I am.
Okay, so check out, we have, if you go to ears and skin, we have topical things that you can do if it gets worse. Try not to, but if it seems to be more bothersome, then there's a whole list there of what you can do.
Perfect. Thank you so much.
You're welcome. Alex, you're next. Are you keeping up with the chat, Dr. Jeff? Get busy.
I have a 15-year-old.
Go ahead, Alex.
I have a 15. You hear me?
I can hear you.
Okay, thanks. I have a 15-year-old dog, and she has kidney disease. She's in stage 2, and she has arthritis. She gets Cartrophin shots monthly. I feed her rice congee, chicken thighs, sweet potatoes, and vegetables, and she takes Aventi Kidney Complete, which is, I guess, a probiotic with her meals. She just had an optimal ultrasound done that only showed somewhat damaged kidneys in like stage 2, but nothing else. But what happens is every time she eats, and I break up her food into 4 meals, every time she eats, about 2 hours later, she starts whimpering or whining, I say. And she's never been a crybaby in her life. And it's like she gets uncomfortable and she has discomfort and it grows and grows. And then once it hit 2 hours, then it turns into real pain. And I don't know what to do with her. And the vet is at a loss. The only other thing is I can't tell, is it as the food is passing through her, if she's standing and you touch her stomach near the, or her tummy near the back, as far back as you can go, she's very sensitive and she starts flipping out her legs. She's also been carrying her tail very low, almost tucked under, but more between her legs, which is strange for her because she's been a tail wagger. She's part lap. So I don't know if it's the arthritis or if it's but she licks her lips and smacks her mouth.
Yeah, it does sound like it's a combination of both. Pardon me for barging in. It sounds like it could be a combination of some arthritic pains and some digestive issues. The digestive system is very, very slow in dogs. So a few hours later, it could be certainly stomach sensitivity and the, feeling uncomfortable there and a little bit of whimpering and whining, but it wouldn't be in all the way back in the colon area of the intestines at that point. So there are a couple of things. Number one, again, as I said earlier, when we have an older dog or cat, it's pretty critically important. Frankly, I recommend that every single person who's on this call do two things right away. I recommend, well, many, many more things like take our courses and all that, but two things. Number one, if you have a young enough animal, get pet insurance. The earlier you get pet insurance, the better. Diagnostic tests are ridiculously expensive now. So it's really important to do that before you have any conditions that then won't be covered. And number two is right now, as soon as you can, regardless of the age of your animals, get into a relationship with a really good holistic vet. So I want everybody to go read that article under Select and find out how to identify a really good holistic vet and know that over the years, you may need to change. That vet may change, your animals may change, the clinic they're at may change, etc. So just, you want to keep that article, keep going back to that article, and it's free. So everybody can take that. So Alex, I'd be paying attention to the digestive while you're finding a veterinarian, which may take several weeks or a month even to get an appointment. Find one and get an appointment and find that that is a good one or not a good one. I would work on different probiotics, different prebiotics, fermented foods, fermented raw goat's milk, fermented fish broth, chicken broth, that kind of thing. And experiment with different foods, completely different foods, and then see what happens with that 2 hours later whimpering and whining. Then everything we talked about earlier in terms of arthritis, I would be working on that. So PT, rehab, stretches, and we've got a lot of that on the website as well. Anything else, Alex?
No, that's really good. Thank you.
Wonderful. Good luck.
Thank you.
Dawn? Have to unmute yourself, Dawn.
Gotcha. Just a little slow on the trigger there. Thank you. I am actually a new Holistic Actions member.
Welcome. Take the 101 course right away. First step.
Will do. Will do. So I am in North Carolina. I live actually near Dr. Judy Morgan. And
Great.
I do need to use heartworm prevention in my dogs in the spring and summer. One of my dogs.
Not the spring.
Gotcha. So I haven't started it yet, so I think I'm on track. But definitely for the summer, one of the dogs came from a rescue, and when he came, he was heartworm positive, and he's free of heartworms now. But he also, we found out, has congenital heart disease. He has a SAS. And so anyway, so the question is, we are using just plain Interceptor when I do give the dose. And I want to know, is there some way, an antidote I can use to help to detox them when I do give their doses? And also,
here's the thing about detoxing. People think, I give a vaccine, I've got to detox it. I gave a drug, I have to detox it. I gave a da-da-da, I had to detox it. most animals may or may not need detoxing. The best detox is rebalancing the energy field. So everything we talk about here today, feeding the best diet, taking the free 101 course, and there are things for vaccines like flower essence para out of sight that may or may not help every animal. But the best is having a holistic veterinarian with a heart problem existent already. Is Dr. Morgan, I didn't think she was taking clients. Is she your holistic vet?
She is not.
Okay.
We're using we got a recommendation from her for Dr. Thiessen. And so she did a huge workup on him. There's so many recommendations. I don't even know where to start.
Well,
But
that's important. Don't go rushing to do them all at one time. And
right.
you may even want to have a conversation about which you should do first.
That would probably be helpful because I have been doing them stepwise, and I told her I was going to work through it stepwise, but it probably would be helpful to help me prioritize.
Yes, absolutely. Now back to heartworm. In the 101 course, I hope we discuss heartworm prevention. If we don't, we need to, Dr. Jeff. The bottom line, I'm going to do this really quick, is mosquito has to be born. Find a dog that has heartworms in the blood, heartworm babies in the bloodstream. Find your dog, bite your dog, and then inject the larvae into the body, or the larvae crawl through the hole into the body. Then it takes 5 to 6 months to migrate to the heart and become adults. A healthy dog will kill those migrating jobbies. The heartworm, quote, preventative goes in and kills them, and then it's out of the system in 24 hours. My experience in 40 years of practice was I rarely, very rarely, saw any negative effects from heartworm prevention, just the plain regular heartworm prevention, used to be HeartGuard. However, other holistic veterinarians, including Dr. Jeff, have seen more problems with the prevention. Now, most of them you can give every 6 to 8 weeks instead of every month. And if you don't do heartworm prevention, which in many areas is fine, with many animals is fine, because their natural immune system should take care of it, you do need to blood test twice a year to be on the safe side. So Dr. Jeff, do you want to make any addition on heartworm prevention?
Just that I just logged into our member area and I forgot that we have an ebook on natural heartworm prevention. So
there you go.
If we have time at the end, we should probably do a quick run through of the
Alex, that's great. Now you can read all about it.
Could I ask one quick addendum to it?
Yep.
Because we are going to do a detox, they were on kibble, like we've just switched a lot of things starting in January. So they haven't done any kind of detox yet. If I am doing a detox with them, like maybe a 6-week protocol or something, is there any interference with the interceptor, or
No.
are they okay to do together?
No, they're fine to do together. The interceptor is specific. It goes in and kills the migrating larvae. And in general, for detox, the very best thing for detox is to learn an energy healing method. So for vaccines, for instance, if somebody knows how to do Reiki, they can hold the vaccine in their hand and do Reiki until it's neutral. Then do Reiki on the injection site, do Reiki on the whole body. Other ones, scalar, etc., many of them can be used the same way. So for me, that's the best detox, even though there are a few others around. But if you're doing detox, it's fine. And you can post in the forum.
Perfect. Thank you so much.
You're welcome. I just want to take a moment for Jay Lum, who's 13-and-a-half-year-old Shih Tzu has lung cancer, was diagnosed with lung cancer. And I just want to be sure that you are you're doing acupuncture, but I want to make sure that your acupuncturist is treating the whole dog, not just sticking in needles. And a PMF pad is fine. I don't know that one is better than another one. And if you're not a member, I would go ahead and become a member and post, because there's so many more. And we have Cancer Month every year. So we have so many webinars on cancer that I would definitely do that. I would avoid steroids if at all possible, and talk with your acupuncture vet about the steroids. And if she's recommending steroids, maybe look for a different one. And you want to feed her whatever she wants. I know you've tried different kinds of food combinations. Just experiment with whatever she wants to eat. And it's okay if she doesn't get vegetables. Some dogs thrive when they have cancer and recover with a keto diet. So every animal's different. So you may want to do just the meat protein for a while, but you definitely need to make sure you're doing calcium, either in bones or a supplement. Dr. Jeff, you made a little frown there.
No,
Comment?
I'm just reading. Well, you have
Okay.
zero minutes to do 2 questions. So.
Okay, 0 minutes. We're going to go over a little bit of time.
Okay.
Geeta, go ahead.
Hi. So I had actually put it in the message in the chat. My dog is a 5-year-old golden doodle. What is this anal pressing? People are saying that I should go get it done. Should I
No.
do this or not?
No, do not. Are you a member of Holistic Actions?
I'm not a paying member, but just a general member.
Okay.
Yes.
So you can also go on YouTube and put in anal glands. We have
Okay.
articles on it. If you were a member, you could read all about it on the website. We have lots of articles on that.
Okay.
But for free, we don't have that. Although you could put in searching the forum for free, you could put in anal glands and read about
Okay.
it there. Otherwise, go on to YouTube just to see what the anal glands are, where they are, but we do not recommend routinely expressing them.
Okay.
It's
Thank
something
you.
that the stool should naturally express by the pressure of the muscle against the stool.
Yeah.
And
Yeah.
only if there are problems. If there are problems, you usually don't have to express. If she's scooting or licking or
Yeah,
smelling.
she's not actually. She's not.
Right,
And
but if
she's-
she does, then you
Okay.
just hot compress for
Okay.
15 minutes.
Oh, wonderful. Okay. Just like a child. Yes.
Exactly. Think
Yes.
child, everybody.
Yes.
Think child. Would you put a chemical collar around your child's neck? Would you put
Yeah.
a prong collar around your child's neck to help it learn how to walk? Think child. Very good, Geeta. That's a good point.
Just one more very quick question. She at 5 months she was spayed, and so she leaks, and her urine leaks. So
You
they
need
put
to-
her on estrogen.
No. Yeah, you need to get a holistic veterinarian to work with.
Okay.
Don't do estrogen.
Okay. I've been trying acupressure, and I give her traditional Chinese medicine, the estrogen that was prescribed for me when I was
But
having
you don't want to
fluctuations.
focus, you don't want to focus on replacing estrogen. You want to focus on rebalancing the underlying energy field imbalance that's causing the lack of estrogen.
Okay.
See the
Get it. I
difference?
get it. Yes,
It could be
absolutely. Yes.
energy
Just the root.
healing,
Go to the
could
root.
be energy healing, could be other
Yeah.
approaches.
Okay.
Gail, you got it really quick.
You answered.
Yes, go ahead,
Sorry,
Gail.
yeah. You answered the question that I had about my dog about the heartworm. I was concerned about
Okay.
giving
Anything
the
else?
heartworm.
We're
Yeah,
out of
just
time. So anything else?
gingivitis. He has bad gingivitis. Is there
Okay.
anything? I
Feed a
heard-
fresh food diet, especially large chunks, as big a chunk as he will eat. Chicken necks, chicken bones, as long as his gums aren't too painful.
Okay.
And if it's an ongoing problem, then are you a member of HA?
No, but I've been thinking about it. So
Well, I would do it, and we have a lot of articles about that,
okay.
about
Well,
teeth health and gingivitis. But I would also recommend having a holistic vet.
what about colloidal silver? Do you recommend
That's
that?
fine. But
Okay.
I mean, it's fine to do that. There are 1,000 things I could tell you to do.
Yeah.
And you can go to the forum and post gingivitis and read what's there. So
Okay.
reading the forum is free. You just can't post unless you're a member. But if you're a member, you can post all this and then we'll give you answers.
Okay. Great.
And we are done, everybody.
Thank you.
So we will actually, Dr. Jeff, before you send this chat out, why don't you send it to me? Because I can't figure out. Oh, there it is. Never mind. I will send it. I've got it. So I will edit it and send it back to you to send out.
Sounds good. And you did it again, Dr. Christina. I mean, you got all the questions. Yeah, you're hot. Yeah, you got it. All right. Thank y'all for coming. Have a great end of your April and May, and we'll see you in about a month or next week, depending on if you're an HA member. Okay.
Great, which
Bye-bye.
many of you are. Bye now.
Thank you. Bye.